Yeah, absolutely. That's a great point. As far as workup goes, kind of going through those questions, like figuring out if there is an underlying condition, but getting some really good blood work, goes a long way. Checking your vitamin D status, checking your testosterone levels, that's kind of like I call them tier one labs. It's kind of like that's the first step. If nothing
Mhm.
comes back there, you can kind of dig in deeper, especially if this has been a chronic kind of issue. You may want to dig deeper, and that's where you can look at, do some genetic testing. If I am
Mhm.
considering, especially with a guy, to considering putting him on an antidepressant, I usually run some genetic testing to kind of give me a better idea of which antidepressant category is going to fit them better. And
Yep.
we've got some good genetic tests that can tell us that, because sometimes this can be driven by some variations in your ability to express certain enzymes and make neurotransmitters. And we
Yep.
can pick up on some of that with some genetic testing. Um, and then the other one is neurotransmitter testing. This one gets kind of tricky because we can test for the metabolites of like serotonin and dopamine and all those nice neurotransmitters. We just can't get to the active level of them, because we'd have to like bore into your brain and biopsy that out, which nobody's going to sign up for. So we have to look at when those neurotransmitters are broken down and then you pee them out. Basically, we can look at those metabolites. So it can sometimes give us a sense, especially if we can see consistent patterns. It gives us a better sense of maybe what's going on. But even that, it's controversial. It's tricky to try to interpret those
Mhm.
labs, but they're still possible, and you can use them for some purposes there. So that's kind of my general like workup, kind of working through those levels and seeing if we can figure out more of a root cause if we can. And if we can't identify more of a metabolic cause for this, then we can kind of start talking more about, all right, well, maybe this is just kind of genetic, or, there's just some issues with some of your neurotransmitters. Let's see how we can support those and see how you respond.